Well, hello everyone. Thank you so much for taking the time to watch our video today. We are super excited to have both Anna and Mona, our doctors of physical therapy with Four Pines Physical Therapy here today. Anna, why don't you take a moment and just tell us a little bit about yourself?
I'm Anna Yanchek. I've been here at Four Pines for about 2 years. I like to treat just general orthopedics, including post-ops. I also do a little bit of vestibular therapy. I enjoy working with runners and just any type of mountain athlete here in town.
Very cool. Well, thank you so much, Anna. And Mona, why don't you tell us a little bit about yourself?
Sure. My name is Mouna Goyette. I've also been working with Four Pines Physical Therapy for the past couple years. I also treat general orthopedics. I have an interest in treating anyone really, from the younger middle school athlete all the way to geriatrics, sports injuries, work injuries, bring it on. I just like working with people.
Awesome. I love it. Well, again, thank you so much for your time today, ladies. Really, today's topic, we're going to really hit on some basics of physical therapy. I know with everything that we've got going on in our community and our lifestyles, things are a little bit crazy. And so I kind of really want to talk through, when is it time to get PT, and then what does PT treat? So Anna, let's start with you and talk a little bit about, what are some triggers that say, hey, maybe it's time to seek out physical therapy.
Yeah, I think if you have any type of injury or movement dysfunction that's disrupting your normal daily life, whether that's work, whether that's putting on your jacket, or whether that's like more recreational, like running, biking, skiing, anything like that, then it's probably time to go in and check with your PT.
Perfect. That sounds great. And so then when we look at, we're starting to see some effects on our daily living, and so we're thinking about PT. And I know a lot of patients have concerns in regard to, do I go physician first? Do I go physical therapist first? What are some specific, like, okay, this definitely seems more muscular, right? So it may be a good time to see you. What would that look like?
So it really kind of depends on what's going on. If you certainly, so we now have direct access in Wyoming for physical therapy. So unless if you're Medicare, Medicaid, or workers' comp, you can come and check with PT, and then we can kind of screen you for, oh, this is a red flag. We need to send you to a physician. And we
Mhm.
can kind of guide you to which physician we think would be best suited for whatever that is. And what it could be a whole host of things that need a referral. It's kind of nice to come into the clinic so we can see that first, and just let you know where to go from there.
Awesome. So then, Mona, what would a initial appointment look like for a patient? And I know that depends a little bit based off of what they're coming to be seen for, but kind of give me a rundown of what that first visit kind of looks like for people.
Sure. Yeah. So basically, you come in with your complaint, and for some people, it's a specific injury or there might be a couple of body parts at hand that they're concerned about. So we're going to come in and just talk to you first. So we're going to get a full subjective history from you. You give us your story, any pertinent medical history or medications that we need to review, or a surgical procedure. So we sit down and we get your story first and foremost. Like Anna said, we make sure there aren't any red flags that we need to refer you out to for to treat outside of physical therapy. And then we do the physical examination. So based on what you've told us, we then pick the appropriate tests and measures so that we can help understand what's going on. And after we get those tests and measures done, we can come up with a treatment plan for you. So during that first session, we'll explain to you what we found with our tests and measures, what that means, and what your treatment plan would then look like. That would be a pretty typical physical therapy first visit.
Awesome. And now, with all of the things going on in our community, I know that you guys now offer the telehealth option. So that sounds a whole lot like what a standard first visit is. Is there any differences between an in-clinic first visit and a telehealth first visit?
Sure. So obviously the hands-on component is lost with telehealth, right? So we have to be creative in the ways that we test our patients since we can't get our hands on. So we do have a battery of tests that you can perform virtually that we still can get really good information from to do basically the same process. So imagine everything you get coming in to the clinic, just you can't have hands on.
Awesome. Perfect. That's a really great explanation because I know those are a lot of questions that patients have, especially in regards to telehealth right now. So, when it comes to, let's say we've done our initial evaluation, we've kind of diagnosed what's going on, or we've understood what's going on, what the root cause is, and kind of have a plan of attack. What does a treatment plan generally look like for patients?
Sure, it's super specialized. Every treatment plan is different. So we're totally individualizing these programs. For one person, that could just be a slew of mobility exercises that they need to perform every day to be comfortable. For the next person, it could be a combination of hands on therapy with some exercise therapy and perhaps some lifestyle modification, like an ergonomic change at work or a positional change. So it's pretty multimodal and it's pretty specific based on the individual patient in terms of what we're including in our treatment and how long, how frequent you need to come to physical therapy.
Okay, very cool. So, kind of circling back to that first visit, and Anna, you alluded to this a lot in regards to the direct access. Is there a benefit to seeing a physician first, or do you have to see a physician first to kind of guide that conversation on what treatment looks like, or anything like that?
So you definitely don't have to see a physician first. If you're more comfortable doing that, you certainly can. It usually the benefit of going to a PT first is we can kind of get rid of that whole first step, which is extra money. A lot of times they'll refer you to PT anyways. You're kind of just getting to that treatment sooner. I think is the biggest benefit there.
Awesome. And then is there open dialogue between physicians? Like, let's say we go straight to, I call you with a headache, and we decide that physical therapy is the best way to move forward with treating my headache. Do you then interact with my physician on the back end, even if I didn't go to them first?
Yeah, definitely. We'll send your physician all of our documentation, notes, kind of let them know that you're in therapy, what we're doing, and if it's working or not. And then if there's some reason we feel that we need to call them or they need to call us, we'll certainly do that.
Okay, fabulous. So now let's kind of dig a little bit into what are some specialty things that you guys treat, or what are some things that you treat? I brought up headaches just because I think that's one of those things that not everybody thinks of physical therapy when they think of ways to treat their headaches. I think a lot of people assume that it's going to just be, potentially a diet, nutritional side, and then medications. But that conservative care component really is a large lasting factor. What are some other things that you guys really specialize in?
It can be all sorts of things. There's vestibular therapy, so vertigo, dizziness, balance issues. You can do TMJ if you have TMJ problems, pain with chewing, maybe grinding your teeth at night. There's pelvic health, just all sorts of different specialties in PT.
Awesome. And so I know there's a little bit of a common misconception of physical therapy is really just kind of a post-operative, or if you're really limited on your motion. What other things do you really feel like these are the things that you see people come in for and you make lasting impressions on, that, before they came to you, they didn't really know that this was something that was within the wheelhouse that physical therapy treats?
I think that something that we're dealing with in this day and age is that we do a lot of repetitive activities. So that could mean your job, you sit behind a computer all day, or you're an assembly line and you're doing the same thing over and over. And even as a younger person, you're doing a high school sport and you specialize in one sport or two sports, or you go to college and you're studying all the time. So we tend to do a lot, and we tend to do a lot of things repetitively. And I think one of the big things that we can do is help people realize what some of the implications of doing that sort of lifestyle is, and how to help them, and recognize some of the patterns and how they can address those patterns either through some changes or through exercise at physical therapy.
Awesome. That is just spot on. I think that's fabulous. So now, when it comes to treating patients, I know that you guys have quite a few things that are available to you that you utilize within treating patients throughout the course of their time with you. One of the ones that I feel like is kind of a hot button that most people have heard of it, but it's generally they've heard of it through a friend of a friend, or they've heard it indirectly. And I like to talk about it just because it can be kind of a concerning thing, or keep people from wanting to be treated sometimes, is that trigger point dry needling. I think those of us, which is me, that are afraid of needles are like, no, I don't want to do that. Why don't you tell me a little bit more about what trigger point dry needling is, and kind of dig into why that is such an effective method when it comes to treating patients?
Yeah, so what dry needling is we use, it's different than acupuncture, although we do use acupuncture needles. We just don't follow the specific acupuncture points, and we usually go a little bit deeper than acupuncture would. There's many reasons that we can needle, one of which is we'll palpate for a top band of muscle or a trigger point, and we'll put the needle in that muscle, and it helps release the muscle. You'll get a little twitch, which will help bring more blood flow to the area, kind of release some of those inflammatory chemicals that you don't want in there. It can be really helpful. It can help gain range of motion. It can help decrease pain. It can help reset the muscle on a neurologic level. It can be a great tool for recovery.
So now I have to ask the question, because if I don't, it would just be silly. Does it hurt?
I mean, everyone's different. It feels more kind of like it's like a deep ache more than it is a pain. I think the worst part of it, at least for me, is the anticipation of it. And the needling part actually isn't that bad.
I would agree with that. Yes. Perfect. So what are some of the other, tools that you guys use regularly? And I know, again, it depends on what the person is coming in for on some different things. I know I've seen and heard of traction being used. There are lots of different things. What are some other big ones that you guys use, and that really kind of help springboard a person's recovery process?
One of the tools that we have in the clinic that's been kind of nice to use is the laser. So laser therapy is fairly new, and what it is, it's a class 4 medical laser. It's a low intensity light therapy, and it triggers a biochemical change within the cells. So if you think of it, like, you can compare it to photosynthesis in plants. So the plants use the light to get food, basically. So in this way with laser, you're using the light to put energy into the cells. And it just kind of increases the body's natural healing response. It's good for injuries that are acute or chronic, whether they're new or you've had them for a long time. If it's more of a chronic injury, you might need a little bit more sessions of laser before you see a big impact compared to acute injury.
Awesome. That's a great description of laser, and that's something that I feel you guys can use on multiple different diagnoses, multiple different symptoms that come in. The laser falls into an additional tool within treatment for many different things. It's taken a lot of time here just kind of going through some basics of physical therapy. We've covered that you don't need to see a physician first to get treatment with physical therapy. I've heard that you guys do offer free screens for those that are kind of confused on, is physical therapy the right place for me? Is it not the right place for me? So that's always a great avenue for people to get started. And that you guys have multiple different tools to help get them through their treatment process as efficiently and effectively as possible. Are there any other parting words that you have for people to encourage them to not wait with their pain? We obviously have in-clinic and telehealth options, so that if they are concerned about actually going out into public more than needed, telehealth is a great option. What are some other last-minute things that you would encourage people to think of?
I would
Yeah.
say don't be shy about coming in sooner than later. I had someone the other day say, "Oh, I feel so silly. These symptoms are so small. They just started." And I said to her, "That's perfect, because the longer you have symptoms, you develop altered movement patterns. It's harder to treat someone that's waited a longer time. So nipping things in the bud in PT is definitely the way to go." So I think if you're feeling your problem is rather small, I think it's still worth checking in for sure. We can probably help and set you up for some good habits, good treatments, and home strategies so that you don't further your injury.
Perfect.
Yeah. And along with that, like a small change in lifestyle, exercise programming, or anything can go a long way. So it's nice to start that sooner rather than later.
Fabulous. Well, again, thank you so much for your time, ladies. Thank you, everyone, for paying attention to this video. If you have any questions, please don't hesitate to reach out to us. Thanks again. We'll talk to you guys soon. Bye.
Thank you. Bye.